We're here today to support and show our love for our local hospitals and send a very clear message to the Ministry of Health and the LHIN and our local board that we need a strategy that allows for multi-site delivery of comprehensive services, including emergency, inpatient, and surgical services at 2 sites in Muskoka.
I'm a senior, and I'm acutely aware through the aging of my parents of what happens and their needs. So if I can project a future for myself and my family, I see the need not decreasing like they are attempting to do, but actually increasing. And this is why it's important not just to stay the status quo, but to go further ahead with what we have and grow and build on that.
What we do today, how we fight for our existing services and the delivery of those services, not only impacts us here today, but it directly impacts our children, their children, and generations to come. The town of Gravenhurst absolutely relies on the services of Huntsville and Bracebridge. Our population triples in size come the summer months. We from Gravenhurst cannot say enough about the excellent service we receive and have come to rely on. We do not want to travel out of Muskoka to receive these same services that could potentially be shuffled or lost forever.
I just got to tell you, I wear 2 hats. I'm a reeve of a municipality, which I love dearly. I'm also a paramedic. I have been for 30 years. I have been dragging people up and down Highway 11 from East Perry Sound, from Bracebridge, from God knows where, to a surgery in the village, the town of Huntsville. I can't tell you how many people those doctors and those emergency services have saved over the 30 years. If we have to drag these people down to Bracebridge, back and forth, it's going to cost money and it's going to cost lives. We have had enough in Burk's Falls. We have put up with it. We come to Huntsville. We support Huntsville Hospital through and through.
Once I moved to the community and was working here, I had the privilege to do obstetrics as a family doctor. But as a family doctor doing obstetrics, you are not an expert and you are not a specialist. And you need help and you need backup. And one night there was a young woman whose husband was stuck out of town, and it was a winter night, he couldn't get back. She knew very little English, and she was new to Canada. And I was very fortunate in that, you know, late at night, there's not a lot going on, and I could sit with her and we went through her labor together. And it was a very, very touching experience, and I think I actually was able to provide some support as a family doctor that maybe you can't do sometimes as a specialist. But as all things go, and obstetrics is really one of those types of things, at the end the baby was born and the abdominal cavity hadn't closed and all their vital organs were spilling out. Once again, a family doctor is not very good in that situation. I can't really do a lot for that. And again, within minutes, Dr. David Allen was in and the anesthetist was in, and that baby's still alive today. What I'm trying to explain is that the whole medical community is a team. And that team, it starts from the EMS people, like our reeve from South or from East Perry Sound, who brings the patient. It goes on to the nurses, it goes on to the support staff, it goes on to the techs in the hospital who do the x-rays. It is a team. There's no part of the team that's more important than the other necessarily, but there are some basic core services that we need. And they're surgeons and anesthetists and specialists. Without that, we don't have a medical community and we don't have a hospital.
It's important to attract people to our community, to Muskoka. It's important for the 30 and 40,000 people who come to this area in the summertime. It's important for all the young families who are here. year-round. And it's up to us. It's our first entry into the health system in Bracebridge, and we need to make sure that it's state-of-the-art, and that's what we on the foundation are working towards.
That's a stack of thousands of names that have signed this petition. We want to make sure that Queen's Park knows that our message is serious and that we mean it. There you go, Norm.
I think in Muskoka we have a unique model in that we have Muskoka Algonquin Healthcare with 2 community hospitals, and I think the important message from a rally like this is that we are unique and we need funding to be able to provide for those community hospitals. And it's great to see the mayor of both Bracebridge and Huntsville working together, as the mayor mentioned in his comments. They had a meeting with the Minister of Health together, and I think that's one of the really positive things about these rallies today, that the towns aren't just kind of looking out from their south, they're looking out for all of Muskoka, and that's, I think, really positive, and I think they have a stronger voice when they do that.
Save our services. Let's hear it. Save